It's Ag USA, presented in cooperation with the 4-H clubs, the future farmers of America, and that's the fellow who's glad you tuned in. Hi there. When you think of the millions of animals in the United States, household pets like this one, livestock, exotic species, animals used for food and those used for pleasure, that's an awful lot of animals. Now, maintaining the health of all of them is an awesome responsibility. In Texas, we rode along with a large animal veterinarian to see what his practice consisted of. And we did the same with a small animal practitioner in New England. Also with some outstanding veterinarians at the San Diego Zoo and the Wild Animal Park. Now, where do all of these highly skilled doctors get their training? At one of about 26 special colleges. And today we're going to visit a typical one. This is the College of Veterinary Medicine at Kansas State University in Manhattan, Kansas. And we're here to find out how tomorrow's veterinarian is being trained to provide a variety of services in everything from private practice to public health, as well as many other specialized activities. Well, what are the qualifications for becoming a student in a college such as this one?
Several years of highly complicated pre-professional training, experience in the field, a knowledge of the profession, and beating out a lot of other persons that are competing for the same seat.
Well, Dr. Nordzi,
Facing the selection committee is a crucial time for the prospective student, for only highly qualified applicants are screened by members of the faculty and the dean's office.
We look for persons who can communicate with others, who have had the ability to go out and understand the profession, who have studied it.
Donald, having observed the profession, what do you plan to do upon receiving your DVM?
I'd like to go back and help the people of agriculture and the people that own animals because they've been so influential.
Of the highly qualified, we take about 1 out of every 3 or 4. It is very difficult to accept certain ones out of a group like that. It's probably the toughest job that our faculty has. They are selecting our future colleagues. They will be determining the character of our profession for the years to come.
Acceptance into veterinary school is the beginning of 4 or more intensive, challenging years of study. In the first 2 years, most of the time is spent with laboratory assignments and in classroom lectures. This freshman class is studying reproductive physiology. A talented, dedicated teaching staff is not only training tomorrow's veterinarians, but instilling in them the values that will be with them through their entire careers. The challenge is, of course, to become highly knowledgeable about many different species of animals. When first and second year students are not in class, they are most apt to be in their home, away from home, the lab. What with their work groups, lab assignments, and individual study, these sophomores keep the lab a constant hub of activity. Typical of second year students is Belinda Mason.
We generally spend about 3/4 of the time in lab and then the rest of the time spent in class. In the lab, we students often get together and quiz each other in preparation for an exam. We can talk amongst ourselves and figure out some point. And if between the two of them, if they can't figure it out, we can always ask the teacher to clarify something for us.
We've already talked about this trichobezoar, but the one that would cause the most problems...
One lab group consists of 4 students, and each cubicle of 4 has their own TV set. Anything we may have had described to us in the lecture, we can see it for ourselves on the TV. The hardest part of the curriculum is that it seems like from the first day, you're always behind. There's so much material and there's so much to learn that it's just a constant effort to try and keep up with all the material they give you. But you get used to the schedule, and it's not as physically and mentally tiring as it was when you first got in. It's really difficult at first because you don't know any of the terminology. In just the matter of a month, you can start talking to the teachers. You can communicate with them because you know the terminology and you start learning things, and it's stimulating. It's what you really wanted to do. That's what keeps you going.
In the third year, the emphasis changes from academic to practical training. An experienced radiologist guides a group of juniors as they x-ray a horse suspected of having arthritis.
Okay, Sue, come on.
Real patients are used in teaching the students, so careful supervision and proper techniques are essential.
All right, start your rotor. Fire.
What we are evaluating now is a degenerative arthritis which is occurring in this joint. Notice
The x-rays taken of the horse are analyzed by a supervising surgeon and his group of juniors. During these discussions, the students learn what might cause arthritis and what surgical steps can be taken to correct the problem. As juniors, these students will assist during the actual surgery. The veterinary school uses the most advanced surgical equipment, not only for the students, but for the benefit of the animal patients as well. By keeping groups small, each student is directly involved in the surgery, and each is assigned a specific duty.
During a surgery procedure, or any time that we are involved in an operating room, the students must be particularly cognizant of sterile technique and always maintaining a sterile environment. The students will start performing surgery sometime in the middle of their first semester junior year. The surgeries that they will be performing will be more or less on a helping basis until they get some expertise built into their approach to surgery. So now, as we start our C-shaped incision, we will start about this high, and we'll carry it right alongside of our drape area. The biggest challenge is to continually encourage them to improve and yet maintain an attitude of complete concentration on the surgery procedure at the time. The biggest reward in dealing with students is to see the student starting in his junior year being completely unable to tie knots with his hands or work any instruments, and then during the course of the year to see that student get so excitedly turned on to surgery, and then ultimately by the time he graduates to be one of the shining stars in this surgery.
Today's students are learning the most modern, up-to-date medical techniques. But veterinary medicine hasn't always been as sophisticated as it is today.
When I first went to the veterinary school at Cornell University from 1914 to 18, the horse was king. Young men in those days didn't want to stay in school. They wanted to get into the war before the war was over. But we had to study, and the horse was the main animal that we studied, because the artillery and all transportation was horse-drawn. So the veterinarian in those days was primarily a horse doctor. Our medicines, we had to make most of them, our fluid extracts and our tinctures and our blisters. When I first came to Kansas, the operating room was a wooden structure about the size of a two-car garage, and there was straw on the ground because in cold weather the surgeon didn't want to get his feet frozen. A typical day in class consisted of 4 hours of lecture in the morning, infectious diseases and anatomy and physiology and so forth. And then the afternoon we would run clinics at the hospital, and then after 3 we would run ambulatory, country calls. In fact, I bought the first Model T that the college ever bought to answer the country calls. Most of the students were older than I was. Some of them were retired dairymen. I had many ranches, and I had an older class of student that was very much interested in becoming a veterinarian. The one thing that hasn't changed is that the students today is still an individual that has to deal with animals. And his dealing with animals is different than it used to be, because now there isn't the physical manhandling. They're much more humane today than they used to be. And it's much more scientific and much more detailed in all the work that they're doing.
The Kansas State University Farm offers veterinary students an opportunity to receive first-hand experience with livestock. Here are raised a wide variety of farm animals. In these outdoor surroundings, faculty members and students can deal directly with the animals, and students can master procedures which they have learned in class. farm also raises animals to be used for the school's important research programs. For example, the control of animal diseases and improved breeding techniques. This special session of Ag USA on tomorrow's Veterinarian will continue right after a message from the stations, and here it is. The veterinary school maintains a clinic for the surrounding community. This complex is designed for both small and large animals, giving pet owners and farmers access to advanced diagnosis and treatment for their animals. After 3 years of lab and classroom study, senior students gain invaluable practical experience staffing the clinic and dealing directly with owners and their pets.
Hi, can I help you?
Yes, my name's Mary Winkler, and I was in earlier today, and they said come back this afternoon.
They told us you'd be in, so we made your record up.
Students spend several hours each week on staff here at the clinic.
Hi, Mary. How are you?
Hi.
My name's Nancy Oden. I'm a senior vet student. You want to come back to the exam room with me?
Sure.
Oh, this is Dr. Mosier, Mary. He'll be the clinician on your case.
Hi, Ms. Winkler. We see you a little late.
Clients relate differently to their animals. They relate differently to people, and you have to have a pretty open mind to meet with the different people, accept their relationship and their values. I think that's a very important part of veterinary medicine, understanding the client as well as the patient.
Students have an initial consultation with the pet owner and then are supervised by a faculty member during the examination and treatment.
Well, Dr. Mosier, I think what we have here is a dog whose primary signs are with the gastrointestinal tract. He's been vomiting for 2 days now. Dr. Mosier, as a member of the staff, is there to consult with us, confirm our own diagnosis, to work with us if we're not able to find a diagnosis, and basically help us communicate with the client, understand the problem the animal has, and arrive at a logical conclusion to that problem.
So, our procedure would be then?
Might need to do an x-ray on him and see what's in his stomach and what's making him throw up. I think the greatest reward in being a veterinary student and furthermore being a veterinarian is helping the animal, certainly, but it's also helping the people. I think we serve both the client and the patient. Many times there's been dogs that have come in that the dog itself was very, very ill, but I felt better after I'd helped it because I felt that I helped the client, you know, that they were real worried about their animal, and I did something for both of them.
The students' lives are dominated by the demanding school schedule, but occasionally they do get a chance to relax. The Rocking K is one of their favorite spots to meet friends and talk about what else? Veterinary school.
Oh, it's interesting, let me tell you.
Okay.
Remember in propedeutic medicine where we had we had our final, and we went from station to station. You had a horse here and a cat. You remember those cats they had? Everybody had their individualized paper, you know, and you had to guard this paper because only you went to this station first and then this station second and diagnose these different things. We were supposed to check the ruminations on these goats. So I was standing there looking at this goat, and this goat walked up to me and he smiled at me and he ate my test. I was dead.
You're kidding.
No, I'm serious. I panicked. It scared me to death.
Oh, I bet.
First final.
Have you ever been around range cows? Up at Clay Center, you're stationed at one barn, and their procedure is you have to go out and pair off the cows and calves that had it the night before. We went out this one time with Steve Nelson and the guy that ran this particular calving barn and and we went out and we got out of the truck. We, corralled him around and everything, and this cow was so mad at us because we were trying to get the calf away. We took the calf by the hind leg, pulled it over. All of a sudden, she just starts taking out for us. I fly up over the back end of the pickup. I kick the guy that's running the barn in the face, and Steve Nelson goes up over the cab. I mean, it was the weirdest thing. But man.
For many seniors, one of the favorite and most productive aspects of the curriculum is the opportunity to go out into the field, something they'll soon be doing on their own. Steve Liebel and a faculty member visit a local farmer to treat a sick animal.
When we get to go out on these field service calls, the big difference is that we get to see the owner's environment and how these animals are being brought up, and also the owner's in more of his own natural setting, and he is more freely talking with us, and you get to see what he's up against as far as economics and how much money you can spend on an animal to treat it. In my 4 years of veterinary medicine, the biggest challenge I had was trying to keep abreast with all the new and different ideas and changing treatments for the different type of animals.
As Steve says, the challenge is to keep abreast of the ever-evolving new ideas and treatments for animals.
The College of Veterinary Medicine is a three-pronged thrust. Training of undergraduate veterinarians or teaching, service, and research. But at the same time, our primary purpose is for the training of the undergraduate veterinarian. Of the students that graduate from Kansas State University at the present time, approximately 75 to 85% of them do go into private practice. Now, we also have a percentage then that'll go into research, that'll go into postgraduate work, will go into education. The college provides several specialized services. One of them, for example, is the embryo transplant service in the bovine species. This one is a service where we can help the particular livestock owner in producing higher quality progeny from one particular sire or one particular dam. In addition to that, we are also utilizing research, basic research and applied research for the control of diseases that are common in this particular area. One of our most unique research tools is the treadmill. It is being used in the area of respiratory disease research. We use it to determine stress reactions on individual animals and then combine it with other readings in our study of respiratory problems. The faculty at the College of Veterinary Medicine not only teach the students, the undergraduate and the graduate students here on campus, but they also actively participate in continuing education programs across the nation. Our continuing education program allows the practicing veterinarian to come back in for new knowledge, exposure to advanced techniques, etc. We are extremely proud of our veterinary complex, the buildings, the staff, the students, and we feel that of the 105 people that we admit each fall in the entering class, that we are admitting 105 all-American men and women.
We asked some of the students why they had chosen to become veterinarians.
I kind of grew up in a veterinary atmosphere. My dad's a veterinarian. Ever since I was a young kid, I'd go on country calls with him or help him down at the hospital.
I wanted to be one ever since I was a kid. There was really never any decision.
I like getting outdoors, working with animals.
I grew up on a cattle ranch, and veterinary medicine is just all I've ever wanted to do.
I've got an ag background, and I guess I've always had a long interest in science and medicine.
Well, this is just where I feel I'm called to be.
I think veterinary medicine is probably the best way that I can serve both animals and man at the same time.
We have seen ample evidence that tomorrow's veterinarian will be dedicated to using his or her considerable scientific knowledge and skill for the benefit of animals as well as for all of society. In just a minute, we'll meet a recent graduate of the College of Veterinary Medicine. First, a message from you-know-who, and here it is. A number of the students who are featured in the film you have been viewing have graduated, received their DVM, and are now practicing veterinarians. One of them is with us now, Dr. Steve Liebel. And Steve, it's such a pleasure to see you again.
How you doing?
Tell me, why did you choose a small animal practice?
I think one of the main reasons I did was you can do more workup with them. You can do more diagnostic tests. The owners are willing to go for this added expense to find what's wrong with their animal. They're more attached to their animals.
But the last time we were together, you were out in the field working on a cow.
That's my second love. I kind of grew up in western Kansas, and I like working on a large animal.
Steve, has anything surprised you about private practice?
Not really. To me, it all came kind of easy. Being from family of the veterinarian, my dad being a veterinarian, I kind of knew what to expect going into a practice.
Well, that's true. And what have you found to be the biggest challenge?
My biggest challenge is trying to keep up with all the current information. Every day, there's a new treatment or a new diagnosis or something like that coming up.
Well, I know what you're talking about. One time we followed a veterinarian around in Texas, a large animal practice, from dawn to dusk. And at 11:40 that night, he was still seated up in bed reading the medical journal just to keep up with the modern things that are going on. So it can be a problem. Well, did you feel that the veterinary college adequately prepared you for your professional career? Now, careful how you answer this because Kansas State may be watching.
Well, for 4 years of college and trying to learn large and small animal, I think they did an outstanding job. All that material for 4 years, you got to get in, and they did a good job of it.
I'm sure they did. Is the work much different in the real world than it was at Kansas State Small Animal Clinic?
Well, the biggest difference I found that at Kansas State, you always had the clinician or the veterinarians there to fall back on if you needed help as a student. Whereas when you're out in the real world practicing, you're there on your own, you're up on the firing line with the client, and it's a lot different there.
Now, you're in Manhattan Beach, California at a clinic there.
Right.
How did you get your first professional job anyway?
Oh, about 3 summers ago, I worked as a student for some veterinarians out there, and I met these guys who are all from Kansas.
Right.
And just happened this last spring, they called me up at school and wanted if I could come out for an interview and work for them, and things happened. I'm out in California.
Well, now, what type of practice is it? I know it's small animal, but is it cats and dogs mainly, or?
The majority is cat and dogs. We do see some exotics. We see a number of birds, some hamsters, rabbits, things like that.
And you have the exotics?
Yeah, we've had a boa constrictor dropped off that animal control picked up at a bar. And
so they found him at a bar and they brought him to you.
Yeah.
Was it healthy?
It was feeling good.
Well, now the exam you had to pass in order to get a state license, was this difficult?
The most difficult part of it was just the anxiety and getting ready for the test. They give you a big stack of notes to study for, and all these people tell you how hard they are. And when you get done with the test, you look back and you think, well, that's pretty easy. It wasn't as bad as it's going to be.
It was kind of that same feeling you had for the initial interview at Kansas State?
Right.
When they were going to accept you or not at school. Well, now, speaking of the tests, does each state have its own test?
Yeah, each state will have its own test, and additionally, you have to pass the national board exam.
Well, that is a lot. And you spent 4 years at Kansas State. What do you miss most besides the rocking K?
4 years of vet school, you kind of grow up with all your classmates, get to know them pretty good. And by the time that 4th year in graduation comes back, you're all in different parts of the country. You never get back to your friends like you used to. And I guess the thing I miss the most is just the camaraderie.
All right, well, maybe you'll go back for some reunions.
That sounds like a good
So,
idea.
you know, there are thousands and millions of cats and dogs all over the country. And what are some of the things that pet owners can do in between taking to the annual checkups that they can do to be sure their animal is healthy? Can you show us?
Yeah, there's a few little tricks they could cheer up the veterinarian with.
All right.
This is J.R. Mewing.
Oh, I hope he isn't greedy. He looks exactly like a cat we have in our homes.
A lot of people, they know their cat a lot better than a veterinarian would, their behavior, their attitude, and so they know if something is wrong with the cat. Some of the things you might want to check is any kind of a discharge from the eye.
How do those eyes look?
These look real good. He's squinting for us.
Oh, yeah.
But if you notice a discharge,
yes, they are clear. They're nice and clear.
Kind of tells what the color is, consistency, things like that.
Right.
Another common thing we see in cats, especially cats with a diet consistent of canned food, is a buildup of tartar. And if you just open his mouth and look back in his teeth, JR's got pretty good teeth. He's pretty cooperative. Also notice how pink his gums are. That's a good indication of health too. If they're pale, good sign of anemia. Blue, he might be having trouble breathing, something like that.
How about the ears?
The ears are a good thing to check too. You might look down in the ear canal for any black, crusty exudate, good indication of ear mites. On the tip of the ears, you might have some hair loss. You might be thinking of a fungus or a ringworm infection.
Now, I know that on our cat, when we first got it, it was a kitten. It got out a few times and got into a fight, and it ended up with some bad abscesses. Now, is this a common occurrence?
This is very common, especially breeding season for the cats and everything. They'll get in a fight, and subsequently they'll get a good infection. You can tell which one of the brave ones. They get abscess in the front, and the guys that run away, they'll get one on the rear end.
Well, this was the rear leg, so I guess he was going in the other direction when he got it. Now, a lot of people, apartment dwellers, keep their cats indoors almost 100% of the time. Do you approve of this, and is it difficult to keep them healthy under those conditions?
Well, it's going to depend. If they're in a large city and they have to keep them in the apartment, then I think that's great. You know, the companionship with animals is a good thing. You're not going to run into any problems such as getting hit by a car when an animal's in the house. Worry about cat fights unless you got a multiple cat household. One thing about indoor cats, if you don't change the litter frequently, they may not urinate there all the time. And sometimes they retain this urine, they can get some urinary problems. And one of the most common things we see, especially in male cats, is a feline neurologic syndrome, whereas they block up and they can't urinate. And what some of the signs that the owners will see is the cat is standing over the litter box and just straining. And now the owners think that he's constipated and they'll let this go. And they think, well, he'll get over here in just a minute. Well, actually what happened, he's trying to urinate and nothing's coming. Well, one thing leads to another, and finally the animal gets really sick and they bring it into us and a lot of metabolic problems go on.
How about if he's neutered? Would that help or not?
Some people think that helps. It's still kind of debatable right now.
Tell me, how often should a person take, for preventive medicine, how often should a person take their cat or dog in to see the doctor?
Okay, after they have their first initial shots, their kitten shots or puppy shots, most vaccinations will come every year.
In other words, once a year?
Once a year is when they have to come back in for the vaccinations. Some people bring their animals in every 6 months is checked.
Yeah, I see. And of course, again, it's a pretty good idea, I understand, to keep a good record of the cat, if it acts anything different than normal, to make notes of it so that when you do take it into the doctor that you can tell them about it. Is that right?
That helps us a lot, because the animal's not going to tell us what's wrong. If the owner can pick up some little thing that might have happened with him, some little quirk that he's not doing.
Great. Steve, thank you so much, and I look forward to seeing you out at Manhattan Beach.
All right, thanks a lot.
Right. Chances are your reaction is the same as mine to this new veterinarian and the students we have met today, and that is their dedication to the protection of animal health, the relief of animal suffering, the promotion of public health, and to the advancement of medical knowledge. We salute them in admiration and in friendship for this important segment of Ag USA. Until next week, so long.